So New York is a big state, and I think, Kristin, you referenced this earlier. The one thing that we know about supportive housing is that one size doesn't fit all. It doesn't fit all the needs of the residents and the communities where it's located. So how from your, and Kristin, maybe I'll direct this question to you, how from your perspective does and should supportive housing vary in order to respond to the unique needs of communities across the state? And how do you make this work? And maybe we'll sort of ask Bob and Daryl as well from that perspective.
I think one of the ways that it can be made to work better in communities is trying to encourage programs and projects that represent not only the needs of the population that will be served in the project or through the supportive services that are provided once the project is operating, but also projects that have community involvement from the outset and that in many ways resemble the face and the landscape of a particular community. So as I referenced earlier, we often in our upstate projects through HHAP will fund what appear to be a lot of small grants, and in terms of the scale in a particular community, that may be a very significant grant, although in the landscape of New York City it would be a pretty paltry grant. But that's really in recognition that in a rural community or in a suburban community outside of whether it's New York City or our upstate cities such as Albany, Syracuse, Rochester, Buffalo, something that looks large is likely to not only face community opposition in getting off the ground, but it's not likely to fit into the overall fabric of the community. And I think that makes integration and involvement by the residents and by the staff in trying to fit into the fabric of the community that much more challenging. So really, I think a lot of it is just about the flexibility of being able to entertain and to be able to facilitate projects that can look completely different, but yet when you dig into them, the populations that are being served are substantially similar to populations that might be served in a very physically different looking project in another community, and that the needs of the homeless, although they vary by the subpopulation, very often there are a lot of very common threads despite the geographic diversity of the state. So there are a lot of similarities as well, but really trying to get the community involvement, which is certainly not always easy. And many of you, I'm sure, have experiences in New York City or other urban environments where NIMBYism has shown its ugly colors. But that, unfortunately, is not unique to urban settings. It's something that providers and project applicants face in more suburban, certainly, and also in rural communities where supportive housing isn't a known commodity necessarily. We've had some providers over the last several years in upstate communities who have been the first to propose bringing the model of supportive housing into a community. And that's not necessarily a welcome thing. You may have a more rural community where the social services department at the county level has been accustomed to using hotel or motel vouchers as a form of housing. That typically does not bring any services, but for the communities in a county that don't have that particular motel in their community, it's sort of out of sight, out of mind. And when you start to get providers thinking much more creatively about how to bring small supportive housing projects to a variety of communities in a particular county, that brings the face of homelessness much closer to those communities and makes it more visible. And that can make communities or certain segments of communities uncomfortable. And so I think it's really a recognition that, as Commissioner Towns said earlier, being able to work not only at the state level, not only at the New York City level, but also in the different regions of the state and understand the unique dynamics of each region and of the various communities in it, that becomes really key to citing the first projects and also getting the acceptance from the first projects so that it can take hold and can be taken to scale later on.
Daryl or Bob,
Sure.
would you like?
I think that sometimes I'm a New York City guy from Brooklyn, but sometimes we forget how large this state is and how different it is. Still a lot of rural, agriculturally based parts of New York State. And so I think because of that nature, all of the state agencies are all built in with that flexibility in order to be able to deal with the different corners of the state. Just in our recent pipeline, we're dealing with a 8-unit homeless housing project in Geneva, New York. 8 units. It's hard to even start a conversation about doing something in New York City with 8 units. But we did 8 units in Geneva, New York, because that's what the locale asked for, and it was a rehabilitation of a current building, so it didn't change the flavor of the neighborhood, but this is what they wanted, and our staff is built that we can deal with that. But also at the same time, we can deal with a 95-unit building in the Bronx, out of New York 3. Totally different types of projects, but one agency that's able to handle all of those. So just the nature of the state kind of builds in that flexibility that we need in order to deal with the different types of applications that come into our respective agencies.
I'd just like to touch on it. It's not supported housing directly, but it's crisis residential housing, which we haven't mentioned today. But we're starting to see as housing providers become part of health homes and performing provider systems, they're starting to talk to us about the need for crisis housing to keep people out of hospitals. And I think this is one area where New York really has to catch up a bit. Some things going on in some other states. So it's another niche area, and again, that's another example. Say in New York City, you could probably do a building with multiple units in it and always keep it full because of the population density here for crisis housing. Whereas in rural upstate areas, you're going to have other models where you may have a room set aside in a group setting, or you may have a rent subsidy where you could deploy staff. But as we talk about supported housing and as you become part of these systems, I encourage you to also think about, thinking about how you could be helpful in this need for crisis residential housing. It could also help you as a housing provider, because if you're having somebody that's struggling in housing and you had a crisis residential capacity, that's another way you could keep them out of going to the hospital. And the Office of Mental Health is very open to conversations about repurposing some of our group home type housing, which are real. We are going to have trouble with this with final rule with CMS. We have this wonderful capital resource that's really kind of a legacy type service, and to the extent that some of that could be repurposed to this other use would be welcome.
Let's stick with this theme for a little bit. So one thing that's apparent in this conversation is that supportive housing is becoming sort of a go-to model of both keeping people out of institutions and moving them out of institutions. So how do we ensure success in this sort of innovation in the model and provide the necessary range of supports that best fit this much broader range of needs for the persons being served? And so, Bob, why don't you?
Well, actually, I'm glad you asked that question. I think the whole notion of Olmsted and fear and MRT and fear and change, we're actually encountering that a bit. We're actually going through a process now where we're continuing to try to appropriately downsize our state hospitals and reinvest those dollars in the community. And we went through a whole process around that this year. So in the budget, we do actually have some money that we're freeing up from downsizing our hospitals to provide about 600 units of supported housing around the state. And we're saying that in order to achieve the downsizing, in order to keep the flow through our hospitals so people that appropriately need it could get in, we need a back door. Now, we can't be doing group homes or things like this anymore. It's not the future. So we're saying 80% of those units need to go to people coming out of state hospitals, and some of the providers are saying, well, how can we do that with the level of impairment? And I think that's where becoming part of health homes and performing provider systems come together. Supported housing is the housing with some modest supports. The wraparound services is the care management plan through Care Management for All, one of the mantras of MRT. So I think that moving forward to serve a range of populations, that housing providers need to think about how they're going to really work closely with care management. Now, I know in the past, some housing providers would say, you know, we have the person 24 hours a day, the care manager isn't always responsive, and that sometimes is true. I think in the future, with the incentives that are being provided through the managed care companies, through Medicaid redesign, performing provider systems, and health homes, if the care manager and the network's not responsive to the support you need, that person is going to go in the hospital. They're going to have to spend money on that, and they're not going to get their incentives. So I think that the whole way we're reshaping the incentives is going to give you, I think, leverage to make sure that the supports that are wrapped around the individual are actually there.
I think one of the things that was talked about in the earlier session too, which this conversation is going to expand, is a continuum of housing care. So have folks who are in need of those support services. What happens when they're no longer in need of those intensive support services? How do we graduate people and make that supportive housing space available for someone else? So I think that those are also going to be a part of the questions. Of course, we have tremendous demands on housing in general, and to put that into the mix, I think will also be part of our challenge as we continue to work down the line.